Hi everyone. So in this video we are going to discuss regarding what are the treatment modalities which are available for the DVT. My name is Dr. Srikanth Raju. I am a senior consultant, vascular endovascular surgeon, foot care specialist. So coming to the today's topic, like what is the management of DVT. So why we have to manage DVT and what is the treatment which is required for the DVT. Usually DVT treatment is required for two important reasons. One is an acute condition, that is immediate treatment it is needed. Why? Because if this DVT progresses leading to pulmonary thromboembolism which can endanger patient's life. So in order to save patient from life endangering pulmonary thromboembolism, patients requires treatment, first thing. And the second reason for treatment is the thrombus which is formed in the legs, if it continues for the long term, then it leads to post-thrombotic syndrome. Post-thrombotic syndrome is nothing but their leg turns to be swollen with color change, lipodermatosclerosis, eczema, causing large venous ulcers which are not healing. So the leg shape, their contour will be changing and leg looks ugly. So for these two reasons, usually we give treatment for deep vein thrombosis so that it doesn't lead to this catastrophic situation in the leg. So coming to the treatment modalities, if the patient have a thrombus from foot to below knee level, this patient doesn't require any operative interventions. Only medical management is sufficient in these patients. And the treatment for duration for these patients requiring anticoagulation is around 3 months. And patients who are having above knee DVT, I mean up to groin region if the thrombus is there, in such patients also requires only medical management, that is anticoagulation. They require anticoagulation for nearly 6 months. Patients who have a DVT extending into the abdomen, that is iliofemoral DVT we call, in such situations if a patient is having a provoked DVT, they require anticoagulation for 6 months, and apart from that they require procedure to prevent pulmonary thromboembolism and post-thrombotic leg. If patient is having unprovoked DVT, in such situation he requires anticoagulation for his lifelong to prevent recurrent episodes in such patients. When coming to treatment modalities, how we do interventions in these patients? These patients usually require pharmacomechanical catheter-directed venous thrombolysis as an intervention which is usually done in cath lab. In that also, in the pharmacomechanical thrombolysis, there are different newer modalities which are available now. Usually, if a patient basic dosage of thrombolytic agent is required in angiojet, penumbra indigo system, in which the bleeding risk and risk of thrombolytic and anticoagulant agents is around 5 to 10%. But if you come to more newer modalities in which the thrombolytic agents usage is zero or very minimal, in such situations the intracranial bleed or high risk bleeding in such patients is very minimal. Those devices are nothing but like clot driver and penumbra flash and penumbra lightning. These are the different techniques which are available where you can decrease the thrombolytic agent to the lowest minimum, or we don't give any thrombolytic agents in such patients, helping the patients not to have any post-procedural complications. With these newer modalities, most of the patients get relieved from the swelling in the leg and long-term prothrombotic syndrome, and immediate catastrophic pulmonary thromboembolism can also be prevented by simple cath lab procedures which can save their life and improve the quality of life. Thank you. If you like this video, please like, share and subscribe my YouTube channel, that is Dr. Srikanth Raju.